Concept 55 is discussing the healthcare organizations. Healthcare organizations in the 21st century will vary in a wide range of ways, including size and sector, private versus public, and so forth. However, the fundamental purpose of all healthcare organizations is to enhance the quality of life by enhancing health. A healthcare organization is not just a location to receive services. A healthcare organization will involve a vast complex of stakeholders and participants, suppliers and purchasers, regulators and direct providers, and individual patients and their decision making. In other words, healthcare organizations, HCOs, are complex and dynamic. They are a product of the interactions of mission and values, internal and external environments, and the motivation and actions of those who work in the organization. Delivery of healthcare services in the United States is driven by the need to provide a broad spectrum of care in a variety of settings to diverse consumers. The delivery of these services requires a highly specialized professional workforce, financed by a mix of private and public funding and subject to oversight and regulation by many different public and private authorities. Whether they are rural clinics catering to migrant laborers, large teaching hospitals in urban environments, or integrated health systems providing a spectrum of services through the nation, HCOs face challenges that require them to adapt and innovate or face extinction. Please take a moment to start the presentation to review the goals for this lecture. We'll start as usual with a definition. So a healthcare organization is a purposefully designed, structured social system developed for the delivery of healthcare services by specialized workforce to define communities, populations, or markets. So, in other words, what this definition includes is that each organization comes together for a purpose. You will see that this is in their mission, vision, and value statements. And they are actually made up of specialized people and were designed to deliver health care to a specific population or community. For example, let's take a look at Valley Children's Hospital. Their mission statement is to provide high-quality, comprehensive healthcare services to children, regardless of their ability to pay, and to continuously improve the health and well-being of the children in the Valley. Their vision is to provide the nation's best health care for kids and to become the nation's best children's hospital. Now, let's compare this mission and vision to the mission and vision for the community regional medical centers. Their mission is twofold: to improve the health status of the community and to promote medical education. Can you see that they are both healthcare organizations designed to deliver healthcare services by specialized workforce? However, they are stating and they are presenting their end results that they are expecting in a completely different way. So what is the scope of this concept? There are HCOs specifically designed to deliver healthcare services such as hospitals and clinics, and there are those that are designed for a health-related purpose but not to deliver services such as pharmaceutical companies or manufacturers of medical equipment. Obviously, a discussion of the concept of the HCO can be quickly complicated by all the different possible purposes and forms of organization. The variety of distinctive organizations with specific purposes defies a simple classification. Now, for the purpose of establishing a scope for this complex topic, only organizations that provide the range of healthcare services for health promotion, illness, and wellness in terms of healthcare will be considered. This encompasses a variety of organizations, however, and those will include and will be limited to hospitals and home health agencies, clinics or ambulatory care centers, nursing homes, and organizations that serve a particular market or population. What will be the attributes and criteria for this concept? So HCOs are distinguished from other types of organization by their unique purpose, by their specialized workforce, and by a level of public trust that separates HCO from other types of organizations. The purpose of HCO is to help others by providing healthcare services. An HCO provides healthcare services to manage illness or promote health, whether those services are childhood immunization care services offered to individuals, families, and communities. This purpose, in fact, stays the same to provide healthcare services regardless of their profit status or ownership arrangements. HCOs are notable for the highly specialized workforce needed to deliver healthcare services. The work produced in an HCO is complex and variable, and at times can be urgent in nature. In this kind of situation, the margin for error is very narrow, with very little tolerance for mistakes that can in fact lead to life-threatening and costly consequences. Health professionals who work in an HCO will undergo extensive education, and they grow their experience by learning. The knowledge and skills that these specialized workers bring to the HCO are necessary for the effective delivery of services in an ambiguous and challenging work environment. The compelling need for this specialized workforce increases the cost for the HCO, but it also benefits the organization in terms of maintaining standards and ensuring quality services. An additional benefit is that the strong professional ideals of these workers will promote and strengthen the service values that support the purpose of the HCO. Furthermore, the work of managing the health of humans is not easily divided because people present with health problems that affect the whole person and affects their families, and in some ways they may affect the entire community. The need to treat a person rather than a disease or a problem is essential to the work of healthcare professionals, and this creates an interdependence among those workers, and this is another notable characteristic of the HCOs. Although labor may be divided among numerous specialized personnel, the need to address the person or the patient as a whole means that each of these professionals is dependent on the knowledge and the skills of the others. Although the HCOs are uniquely defined by their specialized workforce of healthcare professionals, there is a discussion of the healthcare workforce. This discussion cannot be complete without referring to the numerous other personnel that are essential to an effective functioning of an HCO. And I will give you some examples. The Human Resource Department of any large HCO will provide critical services necessary for the daily operations, because most health professionals expect to receive a salary and benefits. Dietary and housekeeping personnel will provide important services within the HCO that support the work of healthcare professionals, as do the administrators that are responsible for ensuring adequate supplies and equipment. Now, because the HCO is a specialized organization with very unique functions, all of these workers should be considered a part of the specialized healthcare workforce. The historical development of HCOs demonstrates a long record of service to others. Early organizations were created by religious orders or by social service groups to provide services to society's most vulnerable members, mainly the ill and the infirm. The work of these early organizations gained the confidence of the public that their altruistic purpose was to serve others by providing care and comfort regardless of personal circumstances. Even though healthcare organizations have taken a hit due to for-profits entering the market, fraud and abuse allegations, and the headlines of mistakes made, trust is generally holding steady. Nurses are the most honest and trusted profession in America, according to a Gallup poll, marking the 18th year in a row the nursing profession has topped the list. Some minor attributes of HCOs now. So those minor attributes are those that define them as forms of purposeful organizations and are features, some of the features that they share in common with other types of organizations. When we are looking at those attributes, they will include structure as policies and procedures, rules and regulation, and organizational culture, and any type of external environment that they exist in. The external environment will include any type of economic trends, new laws, or government regulations. We'll take a look now to the theoretical links related to the concept. The first one will be the bureaucracy. And the bureaucratic organization can be seen as a self-contained and closed system. The drawback for this model of very rational efficiency is that it takes little account of the organization as a social system within an environment. The second type will be the system theory, and in this system theory, the organization has social components that will interact, and those components are affected by factors from the outside environment. Some examples of the social components are the people, relationship, and roles that interact with the environment, technology, and organizational structure in a very integrated manner. And as a result of that, they create a unified and dynamic system. In other words, this is an open system, and their perspective is paving the way for interesting new ways to organize and empower the people who work in the healthcare system. What's the context of HCOs? So in the context of healthcare, HCOs can be broadly classified by their mission, financial structure, and ownership. The purpose of an HCO is determined by the organization's mission, vision, and values. Mission statements issued by HCO describe each organization purpose based on a vision of what the HCO is meant to achieve. The mission statements also describe the values that drive the work of the organization, such as quality and excellence. Even if the HCO is for profit, a privately owned corporation that pays dividends to stakeholders, the mission statement will reflect the values commonly associated with helping others, such as services and professionalism. Regardless of their mission, financing, or ownership, nurses can be found in almost any kind of HCO in which they are, in general, responsible for ensuring the safe and effective delivery of care. The nursing profession in the United States is the largest health professional group. Nurses are working throughout the health services sector and in all HCO because their knowledge and skills are integral to the delivery of healthcare services. Now, nursing contribution to successful HCOs go way beyond providing just bedside patient-focused care, and they will include active management and administration of patient care and patient units. They will conduct research and collaborate with other professionals to coordinate and deliver safe and effective patient care. Nurses will work as case manager, infection control specialists, managers of information technology, human resources specialists, and quality risk managers. Nurses are also directors and executives, advanced practice providers, and admin specialists in HCO and HCO networks. Furthermore, professional nurses affect the environment of HCOs by creating partnerships with other institutions, educating future nurses in universities and community colleges, and working with public policy decision makers to create policies that enhance health services environments. It is likely that professional nurses will be associated in some way with HCOs for most, if not all, of their professional nursing careers. We'll look now into the interrelated concepts, and contemporary leadership is required for HCOs. A leadership that creates inspiration, is able to sustain motivation to achieve results, and that values the contribution of all members. Leaders have to be able to read the environment and interpret the trends or changes for others. They must be able to lead others through many times turbulent and uncertain environments, and must be able to adapt to change as readily as followers. Timely, current, and accurate communication is an essential component of safe and effective care delivery. Delayed, diminished, or compromised communication not only hampers the organization's activities and productivity, but also can lead to serious deficiencies in patient care. Ineffective communication is linked to many instances of catastrophic errors in patient care, such as wrong site surgery or unexpected patient death. Collaboration can be defined as partnership developed for the purpose of achieving optimal patient care outcomes. It is essential that nurses be able to collaborate with other members of the HCO, the patient, and the patient's family to deliver quality healthcare that is safe and effective. The ability to collaborate also creates the conditions necessary for effective mentoring of new nurses and for professional control of practice. Technology and informatics are essential parts to the HCO for ensuring the delivery of safe patient care and the collection of meaningful use of patient care information that provides the basis for much of the evidence used in the healthcare making decisions. We live in an era of the electronic health records, and this is proving to be a disruptive innovation in a way that fundamentally will change how healthcare is delivered. Clinical informatics provide the data and the statistics about healthcare services and the outcomes of those services. Coupled with new government payment system, those outcomes will drive the products and services provided by HCO in the future. In 2001, the Institute of Medicine issued a call for an increased focus on healthcare quality, and since then, many, if not all, of the HCOs and healthcare leaders, including nurses, have worked to identify gaps in the care that lead to patient care errors, and along with that, to propose solutions to address the conditions that are leading to those errors. Many of these proposals are aimed at correcting the problems in an organizational design and function by promoting an error-prone environment in HCOs. For instance, the strategies developed for improving communication in hands-off are meant to promote greater patient safety during transfers between units. Health policies. Well, this is a major force-driven change in HCOs. Obviously, pressures are changes to HCO revenue related to the increased focus on reimbursement for quality outcomes or on changes to healthcare insurance markets that result in greater access to healthcare. Less obvious are the pressures that arise from other policy decisions. Now, to understand it better, consider the impact of decisions by a state board of nursing on the nursing workforce. Suppose a board of nursing moves to require a bachelor degree as a condition of professional licensure. A decision such as this will greatly affect the staffing pattern and pay scales of nurses hired by an HCO. Another example is the patient-nurse ratio. This is probably one of the reasons LVNs work in limited capacity in acute care hospital, if at all. Please take a look at this slide and go back to your book and try to consider some common features of these exemplars, along with what will be some of the differences of the exemplars between hospitals, clinics, nursing homes, hospice, and specialties HCOs. Also, please try and think about what creates all. Question number 1. Who creates and manages healthcare organizations? 1. Hospitals. 2. Companies. 3. People. Or 4. The government. Correct answer is answer 3. People. HCOs are social systems created by people and managed by people. Question number 2. Approximately how many healthcare organizations are there in the U.S. healthcare sector? 1. 53. 2. 530. 3. 5,300. 4. 530,000. Correct answer is answer 4. There are a lot of many different ways to organize an HCO, and as a result of that, there is a large variety of distinctive organization in the U.S. healthcare sector. There is an estimation of around 535,000 HCOs across U.S. Question number 3. How are healthcare organizations distinguished from other types of organizations? 1. They are not meant to make a profit. 2. They are formed only to sell a product. 3. They are primarily designed to help others achieve and maintain optimal health and or well-being. Or 4, their focus is accreditation and public regulatory services. Correct answer is answer 3. The purpose of an HCO is to help others by providing healthcare services designed to help others achieve and maintain optimal health and or well-being.